All right, that is exactly what we'll be talking about today, and that is on hypertension, or basically high blood pressure. But all the same, welcome to the show. My name is Winnie Lumember. Always a pleasure to have you on board. And as we all know, hypertension is a major cause of premature death worldwide, with an estimated 1.13 billion people worldwide have hypertension. And of course, two-thirds of these people live in low and middle-income countries. So of course, we also want to understand why are they mostly affected by this. And you know the drill by now. If you have any question in relation to today's topic, please send us a text message on 40920. And of course, we'll be more than glad to answer your questions as far as hypertension is concerned. And our guest is here, Dr. Nelson Jenga. Good morning.
Morning.
Always a pleasure to have you. Thank you so much for just making time for us today. We really appreciate it. But just in case someone is tuning in today for the very first time and thinking, okay, I have never seen that doctor before, kindly say hi.
Good morning, viewers. As you've heard, my name is Dr. Nelson Jenga. I am a medical practitioner, general medical practitioner in private practice. Welcome to the show as we discuss about hypertension.
All right.
Yes.
And of course, from the video, of course, we saw aspects of systolic, diastolic, all those things. It seems like a very big term. But what they said is anything above 140/90, that is diagnosed as high blood pressure.
Yes.
But now we want to understand, then what's the normal? And what is the range that one should not actually go, beyond or even under?
Okay, thank you so much, Winnie. It is always good to understand what is blood pressure in the first place, because we talk about it. You've had blood pressure ever since you were young, until maybe at the age you are. So blood pressure is actually the force that the blood exerts on the arteries or on the walls of the arteries as it passes through. So we know basically well that there is a system that is there we call the circulatory system. And this circulatory system is comprised of arteries, veins, capillaries, and the heart. So when the heart pumps blood, either to the lungs, because first of all it pumps blood to the lungs that has less oxygen so that it can go to the lungs for oxygenation, and then that blood comes back to the heart. Then that blood is later pumped to the rest of the body.
Okay. All right.
And it is a blood that is rich in oxygen. Now that pumping by the heart, that process of pumping that blood, and now the force that blood exerts on the walls of the arteries, that is what we call blood pressure.
Okay.
So high blood pressure or hypertension is when now that force is high.
Okay.
Yes.
All right. And you see, is it the same? I mean, the blood pressure for children and for adults, is it the same? Or in terms of the numbers, is it the same or is it different?
It is more or less the same.
All right.
There is no big difference. Whether it's an adult or a child,
Okay.
the blood pressure values or the normals fall within the same range. We have said, and during the what we've heard there in the preamble that was played, they said anything above 140/90, the upper limit and the lower limit. Anything that goes beyond that, now we term that as high blood pressure.
All right.
Yes.
And are there people who are sort of genetically at risk of developing high blood pressure? Because from the video, of course, they also said there are no symptoms associated with the same. You don't even know whether they have high blood pressure unless you go and check your blood pressure. But then again, are there people who are just either genetically or just predisposed to getting high blood pressure?
Yeah, there are people basically who are predisposed.
All right.
Or have a higher chances of getting the high blood pressure. Basically, we can say that since there is no known cause of what we call essential high blood pressure, hypertension, that is the primary hypertension. There is no known cause, but there are some people who could be predisposed genetically for reasons we cannot explain. We don't know why they are genetically predisposed, but you find that there are people in the world like the African American, the African, the whites. Those people are more predisposed to getting hypertension compared maybe to the whites alone.
All right.
Or to the Asians and the, I don't know whether the Chinese are what, I don't know.
The Asians.
The Asians still.
Yes.
I think those people are not so much predisposed, but the African American people, the Latin people, are more susceptible to getting high blood pressure.
Yeah.
Even in our setup here in Africa, you found that there are some people who are predisposed. There are some people in a certain area
Yes.
that you find these people tend to get high blood pressure. And sometimes, I don't know, Africans don't intermarry, but in the Swahili world, like in the coastal region, you find that a person marries a first cousin. So you see, if pressure is in the family, so it will still follow that line.
Yeah.
Yes.
All right.
Yes. So those people, like at coastal area, you'll find a lot of hypertension. Yes.
All right. And I think because it's really interesting how, and aside from, of course, in the country in a certain or a particular area, most of the time, like some of these diseases, you'd find that Africans and African American, and of course the Latin, you know, of course, people from those areas are more prone to so many diseases. I think we need to have a research as to why.
Yeah,
exactly
we
those
should.
Three,
we should.
Yeah,
we should.
Those three, I would say.
Many conditions you'll find they are the people who are mentioned.
Yes.
African American.
Yes.
The Latins. You know.
Yeah.
Sometimes the Asians a little bit.
A little bit, yeah. But mostly is African Americans and of course the Latins as well.
Yes.
All right. Okay. So then, how is it? And can we talk about the other risk factors before we even talk about how is it you know, determined? What are some of the other risk factors associated with the same aside from genetics?
Genetics. Okay. There's other risk factors that could be associated with hypertension. First, we say there is essential hypertension. That is the primary hypertension that develops over a long period of time. And most of the time, you won't know you have hypertension. You'll just be walking normally. And maybe it will be discovered when you've gone to a hospital. Because many hospitals, you have to be done a blood pressure checkup. The other the other type of hypertension is what we call secondary hypertension. This is because of some underlying conditions or factors. And so the other risk factors for these two are age. That's another one.
All right.
Age. Age here, we talk about people of an advanced age. I will talk in our setup here. You find that when people in this country get to the age of 40 years, advancing to 50, that is the time they get the hypertension. Basically, I think it's because they grow more horizontally than vertically.
All right, okay.
And they tend to maybe gain weight. They have taken a lot of junky foods. That is now when the manifestation starts to be realized. Right. So age is another risk factor. We have lifestyle. Lifestyle is another risk factor.
This is like a big deal right now.
Yes, and actually this is the biggest now because even lifestyle now has removed the aspect of age because young people as young as 30 years or below are getting hypertension because of sedentary lifestyle. This is lifestyle that you're just eating, there's no exercise, there's no walking, you have a car, you've been taken to school, there's no playing, you're just thinking about books. It's sedentary lifestyle. Even young people that have just completed school, that is the same habit, taking junks, no exercise. So you see, those are predisposing factors. So the lifestyle is another one. Diet is another one, apart from the lifestyle. Yeah, because you could be eating very unhealthily.
Yeah.
Yes. Due to advancement of our economy, it has been noted that many, many young people in this country are resorting to just eating for the sake of eating.
Okay.
Junky foods
Yeah.
everywhere,
Don't read, you
every
think about,
spot.
yeah. Okay.
You go to
All
town
right.
these days, I think every spot there is fast food,
Oh,
fast
yeah.
food,
Everywhere,
fast
even
food.
in estates right
Yeah,
now.
even in the
Yes.
supermarkets, there is
Yeah.
fast food. People don't want to cook.
Yeah.
So you see that aspect of eating the diet that is unhealthy, is a junky diet, is a predisposing factor
All right.
to hypertension. Another thing that could predispose you is conditions, physiological conditions like
Yeah.
pregnancy. You see, there is hypertension in pregnancy.
Yes.
Not all people get
Get it,
but
yeah.
some people do usually get when they get pregnant due to other factors and forces that are involved there. So that is another risk factor. Another risk factor could be smoking. Yes, smoking, tobacco. Because tobacco releases a chemical, there's a certain chemical or some chemicals that are in tobacco that usually damages the blood vessels,
Okay. All right.
the arteries. And when they damage the blood vessels, they tend to narrow. And then you see, we usually say there is always even depositing of some the tar
Yeah.
of the cigarette,
Yes.
of the tobacco in the arteries. So they narrow the lumen of the artery,
Yeah.
thereby increasing the pressure.
Yes.
And also those people who are indulging alcoholism.
Alcohol, yes.
Yes. So those are some of the risk
The risk
factors.
Okay. But what about, and especially for smoking, all right, tobacco, involving tobacco. There's some people who prefer to chew as compared to smoking. Is that a risk factor as
It
well? Because
is.
they'll be like,
It's
yeah,
still
but there's
tobacco.
there's no tar, there's no...
It is still tobacco. It is
Yeah.
still tobacco. There is a chemical that
All right.
tobacco release. Over a period of time, it will have an effect. It will damage the blood vessels.
Okay.
Whether you're chewing, whether you're smoking
smoking.
passively
Yeah.
or actively. You know, we have passive
Yeah,
and
and
active
active.
smokers.
Yeah.
Yes.
Okay.
Even passive smokers are involved. Yes. Everybody is at risk.
Everybody is at risk.
Yes.
Okay, all right. So then, but how common is it? I mean, between, as far as gender is concerned, in what gender do we see mostly cases of hypertension? Is it mostly on women or on men?
Let me say,
Or it's both?
now,
In
where
equal
we've
measure?
reached now,
Yeah.
it is both. A long time ago, we would say that people who tend to get hypertension are women compared to men. But nowadays, men are susceptible to getting hypertension,
yeah.
because of the sedentary lifestyle also they have engaged with. You know, long time ago, a woman would be like a workaholic. Yeah? Working here, working here. So that plays as a part of exercise.
Yeah.
Isn't it? But nowadays, even men, some are not, many men, actually, long time ago it was the men who were getting it more than the women. But nowadays, it's like, it's at par. Both women and men, the female and the men are actually at par. They are all susceptible to getting the high blood pressure.
All right.
Yes.
And in terms of the same, I mean, because we said that there are no symptoms, all right?
There are no
so you
symptoms.
might not know that you have high blood pressure.
Yes.
But then again, so does it sort of start and then progress gradually, or there are those aspects? Because there's some people who would tell you, and even there's one person I know who went and got the blood checked, and it was okay. And then the next time they went, it was on the normal but on the higher side. And then the following time they went, you see, it was normal. So that aspect of fluctuating here and there, and they do not take a lot of, they don't do mostly smoking,
Yeah.
and alcohol. So that aspect of fluctuating, one time it's okay, the other time is on the normal but on the upper side, and the other time it's very high. What could be the reason for the fluctuating?
Okay, thank you, Winnie. You know, blood pressure, it is never constant.
All right.
That is why we haven't given a certain figure and said that blood pressure is 110 over 70.
All right.
We haven't said that. We have said it is between 100 maybe to 140, 60 to 90, the lower one.
All right.
It has a range.
Okay.
Why? Even you and I, sometimes our pressure go up
Yes.
depending on the circumstances we are in.
Yeah.
Our pressure goes up, but our body is able to regulate, to employ mechanism to lower the pressure.
Yeah.
For instance, you're just well in the office, and then you receive some shocking news. What will happen? The blood pressure will
It
shoot.
goes up. Yes.
Okay? You could be suffering from a condition, and that condition predisposes you to getting a high blood pressure, so that when you go to the hospital with a condition for checkup,
Yeah.
that time the blood pressure is taken its high.
Yeah.
Anxiety, depression. There's so many factors that play in here
Yeah.
that can raise a blood pressure
yeah.
even to a normal person that is not a candidate of high blood pressure.
Okay.
So today I go to the hospital. Oh, why is it high? Oh, are you stressed? Can you relax? Yes. But most of the time, it develops over a long period of time,
Okay.
especially the essential
Okay.
hypertension.
Okay.
But there are other types of hypertension, like the secondary one, that is always abrupt with obvious symptoms
Oh, yeah.
that we are going to
We'll
discuss.
look at. Yeah, because I was about to ask then when does it become a problem? Because I think when we talk about fluctuation, I think almost all of us have encountered this.
Yes.
Where first of all, you just go to a hospital and you're told you need to get your blood pressure checked.
Yes.
You get nervous, your blood pressure shoots up.
Yes.
Or something like that. So then when does it become a problem? And then the second question, and I think you can answer this very briefly, is then all right. Okay, forgotten the question, but I'll ask you this.
Yes.
Because we need to take a short break.
Yes.
But if you have any other question in relation to the same, please send us a text message on 40920. And of course, we'll be looking at your questions in just a bit. We'll see you after this very short break. All right, welcome back. Glad you're still with us. This is My Doctor, and today our focus is on hypertension. And of course, remember, like we said, if you have any question, please feel free to engage us on 40920 with your question, and of course, we'll be looking at them in a little while. But for now, we have Dr. Nelson Njenga, of course, who's helping us understand more on hypertension. And of course, like we said, sometimes this is something that progresses, and it doesn't just come instantly, right? So, and by the time so many people go or are diagnosed with hypertension or high blood pressure, it's when it's very, very much severe, and that is when you start expressing some of the signs and symptoms that we'll be talking about in a bit. But before we went for break, Dr. Njenga, I remembered my question. One was that aspect of fluctuation.
Yes.
When does it become a problem?
Yes.
And then the second one was, so then what is the right time to get your blood pressure checked? Because during the day, of course, you're out and about and so many things are happening. And let's say you go and get your blood pressure checked and it's high and you get nervous. So those two questions, when does it become a problem? Then we can start with that.
Actually, I would say that in time, in regards to timing, we don't have, we don't want to say that there's a specific timing for you to check your blood pressure. But you can check your blood pressure anytime. But the first thing you need to know that whenever you go to check your blood pressure, if you are not going there because a condition has necessitated you to go to the hospital, you should always check your blood pressure when, first of all, you're relaxed.
Okay, all right.
Your mind is so much relaxed, you're just there waiting to see how is the readings of my blood pressure.
All right.
Are they okay or are they high? Relaxed mood.
All right.
You don't have any anxiety. That is it. So that is the best time to check your blood pressure,
Okay.
because many people do not have the gadgets. I think if I was asked, I would say people should be sensitized and told you should buy a blood pressure gadgets, put them at home, so that maybe when you wake up in the morning,
You can take
you can.
Oh, yeah.
I think that could be the best ideal time to check your blood pressure. And also, another thing, another time that is could also be ideal is for people who have started to experience some symptoms that they could relate these symptoms to increased blood pressure, such that when they do a certain activity, maybe they feel fatigued and tired. So when they feel that, they can relax a little bit and then check their blood pressure. So it doesn't have a timing, but the best time is when you are relaxed. You don't come from an activity right
Then
away
go
and then you
get
check your blood pressure.
Your blood pressure.
Yes.
Okay, but what about, is it the frequency? Because you see, let's say one might go to a hospital and get their blood pressure checked, and let's say at that time it's high, all right? So does that one check automatically puts you into your diagnosis that you have a blood pressure, or you have to have several checks,
checkups, and also several checkups
Right.
will actually make you become diagnosed with hypertension. Number two, if you have accompanying symptoms
Okay, all right.
and history, including history, family history of the same hypertension in the family, and with obvious symptoms that now relate to hypertension.
Okay,
With physical examination, now the physician or the clinician will correlate the readings with the symptoms and the findings he gets after examining somebody.
Okay.
Yes.
All right. Because you see, what is that called? Is it the white coat? Is it the white coat syndrome or the white coat something? Where someone goes to a hospital, sees the white coat, the doctor's white coat, and automatically the blood pressure goes
the
high.
blood pressure goes up. Yes.
Yeah.
Yes.
All right.
Yes.
So again, so it takes a number of checkups and of course, like you said, accompanying symptoms.
Yes.
So what are those symptoms?
But there are instances now when you if the pressure is 200 over 120 or now that one we cannot say that we need now to do many
tests.
Okay, we will still check again and again.
Right.
But if it's the reading are consistent, then we don't need another day to come and make a diagnosis that you have, because that is now even a bad
serious.
pressure, a very bad pressure. It can cause a lot of complications and even death.
Yeah.
Yes.
Okay. So then what are some of the symptoms that we're looking at? The accompanying symptoms that we're talking
The
about?
accompanying symptoms that you could look at and maybe start saying, could my pressure be high? Number one is a long-standing headache.
Okay.
You know, headaches are sometimes common. People get headaches.
Oh, yes, all the time.
Yeah, because of 1, 2, 3 issues. You could have cold and flu and you have a headache. You could be stressed, you have a headache.
Have a headache, yeah.
So, but if it is long-standing headache that doesn't go away even after taking maybe a painkiller, because normally a human being gets a headache. Let me go and buy a painkiller.
Yes.
The headache doesn't go away. If you have blood vision, start realizing that now my vision is not correct.
Yeah.
I have blood vision. Then that could be a sign of hypertension. If you get fatigued, easily, easy fatigability. You're just walking, you want to go up the stairs, even not first floor, you're already tired.
Yeah.
And previously, you didn't have the same problem. So this one will make you realize something is happening in my body. So could it be that my pressure is going up?
Yeah.
Awareness of your heartbeat, what we call palpitations. Now, you know, normally you don't feel your heartbeat. You just walk, you do your normal things. You don't feel the heartbeat.
Yeah.
You don't even know whether the heart is
It's
beating.
beating or not. Okay.
But now when you start becoming aware of your heartbeat, and that is another sign that you could be having high blood pressure, hypertension. Another thing could be swelling of the feet and the lower limbs. And this is not swelling that is maybe normal, like when you make a long distance travel.
yeah.
No, maybe you're in the office and then you start noticing, oh, my legs are swelling.
Yes.
You see, that is another sign.
All right.
Vomiting is another. It could be another accompanying sign, especially when the pressure is extremely high.
Okay.
You find that vomiting is there. The other one could be, I've said 4 or 5 symptoms.
Yeah. What about like aspects of fainting? Do we notice people
syncope,
fainting?
yes. Some will faint or even have seizures. Yes, somebody will say, oh, mtu amekuwa epileptic, they become epileptic, and we've never noticed something like this. Now that is very high blood pressure, which could have even caused some damage to the brain.
To the brain, yeah, you're right.
Yes.
And what about like aspects of breathlessness and
yes, shortness of breath.
Of breath, yeah.
Breathlessness, shortness of breath. That is somebody walks or wants to go uphill a little bit, and then they start getting shortness of breath, what we call dyspnea, because now you want to gasp for more air, and then it is like your body is unable to help you get the more air.
All right.
And also issues, there are other issues like we call sleep apneas. Sleep apneas. You get shortness of breath while you are asleep. So those are some of the symptoms that could
the one
point.
should look at. And for the headache, can you just go back a little bit on headache, where you see, like you said, and rightly put, that we all get headaches here and there.
Yes.
And it's sort of like a common thing, but of course they always say headache is not a good sign. It means there's something wrong with the body. And there's some people who have, or the areas of the head where you feel, you know, the headache.
Yes.
Yeah, and someone will tell you, oh, they'll just touch, let's say, one of the areas, tell you, oh, where exactly do you feel the pain?
Yeah. Even the doctors will ask you, where
exactly?
Do you feel the headache?
So hypertension, where exactly?
Most of the time, the hypertensive headache is backward, occipital. You will feel it here.
Okay.
Yeah.
At the back of the head.
You could feel it frontal or on the sides, but most of the time it is occipital.
At the back of the head.
Back of the head.
All right.
Yes. And that is a very distinctive headache. Then now will tell you, why am I feeling, and dizziness, you know, that's another symptom, could be dizziness. I feel a lot of headache and dizziness.
Okay.
Yes.
And is it on and off, or is it consistent? You see, for migraine, it
could
doesn't
be
just go off.
on and off.
All right. Okay.
On and off. You realize that every day at a certain time I get a headache.
You feel, okay, all right.
What could be happening? Or it could be long standing. When you take the painkiller, it kind of subsides a little bit, and then afterwards it flares up.
Yeah. All right. And then we should be, I mean, like you said, I know we're busy and all these things. Sometimes we don't even take time to notice, but just sort of learn your body and understand where the pain comes from. All right. And we also know that it could lead to stroke.
It could.
So is this when it's like really, really high and it's not controlled, or what usually happens?
Actually, for high blood pressure to lead to stroke, stroke is one of the complications of the high blood pressure. And so what happens is this. What is stroke? It is good to actually define and know what is a stroke. Stroke is what happens when the brain does not receive sufficient blood. Okay? Simply, defining it simply. When the brain does not get sufficient blood, either due to blockage or due to hemorrhage. Yes. So So how does hypertension lead to stroke?
Yeah.
What happens is that we said I don't know whether we talked about the factors that contribute to your increased blood pressure.
Yeah.
I usually like to make a discussion of when we are receiving water from I don't know which dam, so somewhere dam or somewhere, I don't know, it's called what, the one in Gatanga there. When water is coming from that place, it is usually in big pipes, large pipes with large diameters, isn't it? But when it comes to reach us, it is usually on small pipes. So the lumen is reduced. And so the pressure increases. It cannot come all the way from there with that big,
in the pipe and
then it has to be distributed to where and where and where, whatever. So what happens is this. Those conditions and factors that we talked about and the risk factors we talked about, most of them damage the blood vessels, the capillaries. So, number one, they could harden or reduce the lumen. Especially, we talk about tobacco. We also can talk about some fats. Cholesterol, high cholesterol,
the bad ones,
yes, they will go and coat the lumen, reduce it, what we call a condition we call atherosclerosis. And when it is reduced, so the blood supply to that organ, number one, is reduced because it can narrow to the point of blockage, isn't it? Number two, the blood vessels in the brain can be damaged, become weak, a condition we call aneurysm, and when it becomes weak, now it can rupture. When it ruptures, it will reduce the amount of blood supply to the brain, and so the brain tissues will start to die. That is what we call a stroke, and that is how hypertension causes stroke.
Okay, and all right, does everybody then who has hypertension automatically will get a stroke?
No.
Okay.
But they are at risk.
High risk.
A very high risk.
Okay.
Especially somebody who has hypertension that is not diagnosed. You're just walking with it. Sometimes you take some people's blood pressure and you're like, what? And you're walking.
Where were you? Yes.
200 over like 140.
Wow, that's
it's
too
a
high.
terrible thing.
Yeah.
And you, are you feeling anything? No, I'm just okay.
Yeah.
You see? So that one calls for us to be very vigilant and very take care of our bodies. Just go once in a while, check your blood pressure.
Okay.
Yes.
The earlier you know, the better.
The earlier, the better.
Yeah.
Yes.
So that we avoid cases of complications.
Yes.
Okay. So then what usually happens when one goes to a hospital? Let's say I think we can start with those cases where they do not have symptoms and they just want to or diagnosis. Yeah, let's say someone has some of the symptoms that we talked about, the earlier symptoms, because these are the ones, like we said, it's serious.
Yes.
All right. So the earlier symptoms that we talked about, when one goes to a hospital, what are some of the tests that are done to just ascertain that it is high blood pressure and not any other condition?
Okay, for us to ascertain that this is really high blood pressure, actually is to take a blood pressure test.
Yes.
That is number one. If we take your blood pressure and we find it is high, now we correlate that pressure being high with the symptoms that you present with at the hospital. Maybe the symptoms could be pointing to the high blood pressure.
Yeah.
Or this the pressure that has become high, the hypertensive that you have at that time, could be as a result of another underlying condition. So diagnosis is actually made when pressure has been taken, I would call it more than 3 times, and it remains to be high.
Okay.
Yes.
All right. And
the symptoms. Now you now relate with the symptoms and then make an obvious diagnosis. And there are other tests we run to see could it be because you have an underlying condition,
yeah.
like a kidney problem, a heart problem that could be leading to this high blood pressure.
Yeah.
We also want to check your cholesterol levels and so on and so forth. Yes.
All right, so number of tests.
Yes, many.
Okay,
Yes.
and you talked about the three that, of course, it's important to look at. You know, because like we said earlier on, you don't just do one test
and then you say, you have blood pressure.
Okay, so then at what intervals? I mean, let's say one goes to a hospital, has the symptoms that we talked about, and then they get their pressure checked. Are they given like some time, depending on how high it is? Because like we said, if it's 200, that is too high,
Yes.
cannot wait. But let's say it's earlier, slightly above the normal.
Yes.
Yeah, are they given like quite some time to just go and observe
Yes.
and then come back? And if so, at what intervals are we looking at?
Actually, when you come and there is no obvious underlying condition,
Yeah.
and now maybe we realize the factors that are making you have the high blood pressure, we look at, we check at the history, maybe we identify either there is family history or there is no family history.
Okay.
So we check at your weight and height, and maybe your BMI is high, maybe you're overweight. So what we are going to advise you, we are not going to, if the blood pressure is not that very high,
All right.
we are not going to start you on antihypertensive medications. What we are going to do is that we are going to advise you
All right.
on lifestyle change, diet, exercises, all those. As we give you what we call reviews, to come for reviews,
All right.
dates for reviews, so that we check your blood pressure, we monitor. It's not a must you come. We can even tell you, go to your nearest health center, let your blood pressure be monitored like daily, and then after a week, come with those tabulations.
All right.
Let us
So they
see
can-
how have you been performing. Are you improving, or you're not improving, or you're getting worse?
All right.
So that at that point now we make a decision. If you're not improving, we start you on antihypertensive.
Okay.
If there is an underlying condition, treat the underlying condition.
Okay.
Or address it.
All right.
Yes.
And at that time, I mean, are there things that one can do to sort of bring it back to the normal range? Or once it's high, you have to be on medication?
No.
Okay.
It depends,
Okay.
as we've said, with the factors.
Yeah.
If it may be a familiar thing, sometimes it is hard because some people will get it, they are not overweight, they are not even big, but they have gotten the hypertension.
Yeah.
So with the history, you will realize this is a familiar thing.
Yeah.
So this is somebody who needs to be on drugs, but also you don't now do away with the issues of advice in diet and lifestyle change and all that.
Yeah.
So once it is high, it is not that it is now defined, you have to start the antihypertensive, or when it is high, it won't go down. No.
right.
When you employ some of these basic things, lifestyle change, actually we usually say start with observation.
All right.
Yes, and advising the patient on lifestyle, diet, and exercises. If it doesn't resolve, then start on antihypertensive.
They can, all right. Okay, and are they supposed, okay, anti-hypertension then, the hypertensive,
Yes.
you know, the medicine, is it the only thing, or are there, let's say, types of treatment or medications that also accompany the anti-hypertensive medicine?
The antihypertensive medicine, when we start you on those now, that is where now we will refer you to a nutritionist for advice on diet. We can now we will tell you about exercises. That will depend on, are you able to do exercises or not? You know, some people are reserved. They want to go to the gym.
Yeah.
Somebody else wants just to walk. Somebody wants to skip a rope. Those are exercises. Somebody just want to walk for 2 kilometers per day. You know, there are so many factors here that we will consider when we start on antihypertensive. It can be antihypertensive alone.
All right. Okay.
Or antihypertensive with other therapies.
Okay.
Because somebody who is totally sick, bedridden, comes with essential hypertension that is very high. How do you tell this person, now I want you to start exercising? And is bedridden. That is a person you start on antihypertensive right away, even as you monitor them and find out, are there other underlying conditions that could be leading to hypertension? And also, it is always good, like the women, let me say for women who are in the reproductive years, sometimes we've said that some medicines are associated with an increase in hypertension, and especially those who are on contraceptives. So if we realize it's contraceptive, we just tell you to stop. And choose another method.
Okay.
Yes.
And how long is one supposed to be on antihypertensive medicine?
Oh,
is it lifelong or?
Now, that one will depend on how the response to
the medication.
To the medication.
Okay.
If you respond very fast, and you know we cannot just withdraw like that, we will have to do what we call tapering. We withdraw slowly by slowly. As we make, we do the monitoring of your blood pressure. We can't just say, Ati, no, for you as we are going, you know, I've heard some herbal doctors saying, we just treat hypertension within 3 months. We cannot give a duration. No. Yes. Because if it is because of diet and lifestyle and what, if you address that, then your pressure goes back to normal as almost as fast as possible. Yes.
All right.
But if it's because of congenital, acquired, congenital hypertension that is genetically related, you see now that is also a tricky thing. Yes.
And what about, I mean, we did gestational, no, not gestational, preeclampsia in one of the episodes.
Yes.
But just to go through it, because I mean it's also hypertension or high blood pressure, of course, during pregnancy. For them then, does it go away after delivery? Just to recap on the same, or they also have to be on medication for lifelong?
Most of the time, people with preeclampsia, after delivery, it goes away. But there are some subjects that you find the pressure continues to be high. So they need to be continue to be monitored and to be on antihypertensive until a period whereby we now realize that we are giving you the medication and the pressure is going very low. And you see now that is called hypotension. It is also dangerous, very dangerous. So it is all about taking care of the patient, monitoring them. Even after giving birth, you cannot just stop the antihypertensive on somebody who had preeclampsia. You have to monitor them, put them on, continue putting them on antihypertensive, maybe at a lower dose as you monitor. Can change the medication because we have many types of antihypertensives. You keep on changing, monitoring them, and so on. And when you now realize that their body is able to control the pressure on their own, you stop the antihypertensive.
All right.
Yes.
Okay. So then I know we talked about a little bit to do with the complication, and one of them, of course, we said is stroke.
Yes.
All right. But what are some of the other complications that might arise? One, either in delayed time to seek treatment, or two, completely not dealt with.
Okay, I will divide those complications and talk them in broad. I think I'll do 3 or 4.
Okay.
Number one, we called it stroke. And we've already discussed stroke. The other one could be you can get complications in your eyes. That is what we call hypertensive retinopathy. All right. And that we said one of the symptoms, blood vision. I'm seeing double people, you know. I'm not able to see well. I used to see well. I'm not able to see the book. I can't read well. So blood visions, why? Because sometimes the veins and the capillaries and the arteries that supply blood to the eye due to this excessive blood pressure or high blood pressure, they are damaged.
Yeah.
And you see supply is cut, and then the eye is affected. So you get what we call hypertensive retinopathy.
Okay.
We also have issues of damage to the nerves. We call it hypertensive neuropathy, where you start now getting numbness of the hands, of the feet, of the body. You feel numb, you know, and also numbness. People should be very careful because numbness could be a sign of stroke. Numbness on one side, weakness on one side.
On one side.
Yeah, it could be a sign of stroke. So when you start getting numbness, feeling burning sensation in your feet, tingling sensation, you know, tingling sensation, burning sensation, that is numbness already. It is called hypertensive neuropathy.
Okay.
We also have hypertensive nephropathy. This is when now, over a long period of time, the effects of high blood pressure have now damaged the kidneys.
The kidneys, yeah.
Yes, because we talked about narrowing of the blood vessels due to atherosclerosis. When there is that narrowing, the blood supply to the kidneys is cut or is reduced. And so some of the cells of the kidney start to die. The functions of the kidney is impaired. Now you get what we call renal failure or kidney failure. You have seen it with people with hypertension. It is actually one of the kidney failure is among hypertensive and the diabetics.
Yeah, and we've seen a lot of cases of the same where someone says this one had hypertension, but then developed
kidney failure. So that is a complication, hypertensive nephropathy. We cannot also not fail to mention that the effects of the high blood pressure can lead to what we call cardiac failure or heart failure. Heart failure doesn't mean that the heart has just failed. Now you can't live again. But people are walking with heart failure, meaning because of that increased pressure in the blood vessels, the heart is forced. You know, the heart is a muscle. It is forced to pump a lot of blood with a lot of force. Now, it is using a compensatory mechanism to do that. So in the process, the muscles enlarge. And especially the muscles of the ventricles, they enlarge. And when they enlarge, you know, they cannot go back. So in that process, when they pump the blood, it doesn't go all of it. Some of it remains. So there is an accumulation. So the heart starts to fail. There is a backflow, goes back to the lungs, to the liver, swelling of the leg. You see, you get what we call heart failure, or you can either get chronic, what we call chronic heart failure, and so on and so forth. And then another thing you can get is what we call a cardiac arrest. Yes, a cardiac arrest comes like this because the blood vessels, we say they are narrowed by atherosclerosis because of accumulation of cholesterol in the lumen. So the supply to the heart is also reduced. And so the heart muscles that are supposed to be supplied with the blood for contractibility and relaxation, that they die off. And then you develop a cardiac arrest. Yes. Wow. And that is death.
Okay. Yeah. So, well, okay. Whew. Very, very, very scary, complications over there. And then do we get instances where, let's say, one does not respond to antihypertensive medication? Is there a way that, let's say, the body is not responding to it, there's no change? And if so, why? Like, why do we have cases of people who are not responding?
There are cases whereby somebody is not responding to antihypertensive, but these are extreme cases. For instance, when you have like end-stage organ damage, like the kidneys have been damaged, the heart is
Has been
failing,
yeah.
the liver has been damaged. You know, at that time you can find a scenario where the antihypertensives don't seem to work.
Yep.
But most of the time, many antihypertensive work. If you find this class is not working, you are at liberty to change, and
okay.
give the patient another class. Also, at times when the antihypertensives are not responding, it is always good to look, could there be another underlying thing or
Yes,
condition
that
that is
causes,
making
yeah.
the antihypertensive not work? But most of the time they
it works.
just work.
Okay.
Yes.
All right. So then what do we do to just prevent all these cases? Because like we said, the complications are really, really bad.
They're
I would
bad.
say they're really, really bad. So then, and we do not want people to get to that point where, of course, we start experiencing some of this, complications and all that.
Yes.
So then what do we do to prevent? And earlier, even before the diagnosis, before the symptoms, before all those things, what can we do to prevent cases of hypertension? And especially because right now we're seeing, like we said, a trend where younger people are actually developing hypertension as compared to back then where we used to see this, with, the older people.
Actually, prevention is about, okay, I would say being sensitive, learning, loving ourselves. Let's observe, number one, a healthy culture, a healthy culture that is in forms of diet. Young people, not even young people, people in this country, have you realized that when people get money, they now think the food they used to eat
we change.
was not good food.
Yes.
So they start eating junky foods, and then they think that is now sijui ni kuendelea or it's what. But let's observe a healthy diet. Number one, that is prevention. Number two, let's always have regular checkups for the blood pressure. Stop sedentary lifestyle. Please, let us stop this you can't even go from here to which is the town that is near here, and it's almost less than a kilometer. You can't walk.
You have to go with
just
the car.
want to go with your car. Sedentary lifestyle. Let's exercise. Let us exercise. Let us stop excessive consumption of alcohol. Stop, quit smoking. Yes. Those are preventions that I could actually say. And those people who are at high risk, like those people who are genetically predisposed. Let them have regular checkups, Let them have regular checkups so that they can be able to detect when the pressure is going up very fast. Yes.
All
and then they can get the advice from the doctors and the medical practitioners.
Closely monitored.
Yes.
All right. Okay, Dr. Njenga, in the interest of time, we have to end the show. But thank you so much for always honoring our call to just come by and help us understand on matters, health, because at the end of the day, it's very, very important, like we said, to move to more on preventive care compared to curative care. So thank you so much. And of course, thank you so much for staying with us as well until the end of the show. I believe that you've learned a lot as far as hypertension is concerned. So we have to end it here. My name is Winnie Lubembe. On behalf of an amazing team who put together this show, we wish you a lovely day ahead. We'll see you on another episode of My Doctor. But for now, have yourselves a lovely day ahead. Goodbye.